This section will be on types of oral cancer, learning objectives, warning signs of cancer, describe the appearance of lesions with smokeless tobacco, and 5 lesions that are associated with HIV. So, looking at oral cancer is one of the 10 most common cancers in the world. Although we don't hear a whole lot about it, if you really get to working with patients, you're going to hear more about it in the future. The incident as well as the site of the cancer varies greatly from country to country. Interesting to know that in the Western countries, the site most often affected is the vermilion border of the lip. I hope you remember where that is located. It's around the border, outside border of the lips. Ladies, you will know it as where we place our lip liner. So the outer edges of the lips. Most oral cancers do not cause pain in the early stages, and the dentist is most likely to be the first to detect them, so detected more by dentists than by patients. These cancers are fatal if not detected early enough or if they are left untreated. They are very vicious and fast-growing type cancers. Here we have a squamous cell carcinoma of the lower lip. And obviously we can see that there's something wrong here. And that's something patient could notice this, but definitely the dentist, hygienist, and all should be aware of these type things when they do the cancer screening. And a dental assistant sees anything like this, you know, it could be an ulcer, could be a lot of different things, but unfortunately this one was not. So a carcinoma is a malignant neoplasm growth of the epithelial tissue lining in the mouth. So that is what the dentist would be looking for. And an adenocarcinoma is a malignant tumor that arises from the submucous glands under the oral mucosa. A sarcoma is a malignant neoplasm arising from supportive and connective tissue. So one thing I want you to notice here, you have the terminology like carcinoma, but I also want you to know the terminology neoplasm. So it's a growth, okay? Then you have the osteosarcoma, is a malignant tumor involving the bone. In the mouth, the bones, usually the bones of the jaws, although the cancer may start in the bone, it will spread to soft tissues. And when a cancer has metastasized, it spreads to other tissues or areas of the body. Okay, so let's look at this terminology one more time. We have carcinoma. We have neoplasm, which is a growth. We have adenocarcinoma. We have sarcoma. And we have osteosarcoma. And let me point out with osteosarcoma, you know, that's fairly easy to remember because osteo means bone, and then you have sarcoma, which is a malignant neoplasm. And then you have the word metastasize. So that means it's spread to other tissues or areas of the body. So let's look at this panorex, and this is a good indication as to why we need to have a panorex every so often. A lot of offices do it 3 years or 5 years, but if you look at the radiolucent area in here, this is the left side of a panoramic x-ray, and this is a squamous cell carcinoma. So no one's ever going to see this or notice this other than a dentist, because there'd never be a reason to take an x-ray here unless the patient had some reason to complain. So this is fairly advanced, but it's definitely something the dentist could pick up on and get the patient into the right hands. Okay, let's talk about smokeless tobacco or chewing tobacco or snuff. It's a very serious health hazard. So it's a major concern because of the high rates of precancerous leukoplakia and oral cancer among users. So remember what leukoplakia is. That's the warty patch type lesion that we looked at earlier. Excuse me. And a lot of times that is brought on by holding the chewing tobacco or the snuff against the tissue. There are also cancers of the pharynx, the larynx, the esophagus. These occur 400 to 500 times more in people that use smokeless tobacco. It's also linked to an increased incidence of tooth loss and periodontal disease, definitely periodontal disease, and then because of the sugar in the smokeless tobacco causes a lot of decay. Here we have a picture of a tobacco chewer's white lesion, and if you notice it, if you'll look here, you'll notice it comes from here around through here and then back up around in this area. So this is where this person has been holding the tobacco, and obviously if you look at the teeth and the tissue, you'll see some problems going on there. So this is probably snuff. It could be the chewing tobacco. Typically they will hold that in this area or over in this area of the vestibule. But this is a precancerous lesion. If the irritant is not taken away, eventually those cells will become malignant. So what are some dental implications of radiation should a person have some type of head, neck type cancer? You have xerostomia, and we know that is a dry mouth. So a lack of adequate saliva and the reduced blood supply can cause oral infections, delay healing, and make it very difficult to wear dentures. So a person that's going through radiation treatment, their mouth is going to be very dry. Radiation caries caused by a lack of saliva. Radiation caries usually appears first in the cervical areas, and the cervical areas being at the gingiva. The teeth also may become extremely sensitive to hot and cold. So that two things that will happen fairly often when a person is receiving some type of radiation treatment. Okay, and the last one here we have osteoradionecrosis. Osteoradionecrosis. This would be osteo meaning the bone, radio from a type of radiation, necrosis meaning death. Okay, so the bone may be subject to necrosis or death after radiation treatment. And we know if the bone dies, then obviously the tissue and the teeth and all, and it's going to be a very extensive issue. So here's some pictures of some adverse side effects of radiotherapy. Obviously here you have a very dry mouth, dry tongue. You have some ulcerations here, some discolorations, and the same thing here. So this is mucosa that has been radiated. Okay, so some other implications for chemo and radiotherapy: mucoitis, aphthous ulcers, cheilitis, glossus, paresthesia, xerostomia, delayed healing, and dental malformation. So all of these things, we have a long list here of things of dental implications when a person is going through chemo and radiation. So it's very, very important if they feel up to it that they are able to keep their regular dental appointments. Okay, looking at a type of cancer, leukemia. That is something that people say, well, now why are we talking about leukemia in the mouth? A lot of times leukemia, that'll be the first place that the signs and symptoms will be noticed. All right, so let's look at leukemia. We know it's a cancer of the blood organs. It's characterized by rapid growth of white blood cells, and so that means there's going to be infection. Oral symptoms of leukemia may be some of the first to be indicated of the disease. So a lot of times at a cleaning or a dental appointment, this may be picked up there and then referred on to the physician. Now, the dentist is never going to diagnose anything like that, but if they feel like there is something suspicious going on, they're going to refer them to the physician. Symptoms in the gingival tissue include hemorrhage, ulceration, enlargement, spongy texture, and a magenta coloration of the gingiva. So magenta being sort of a purple color. They'll have enlarged lymph nodes, symptoms of anemia, and just general bleeding. All of those things can be signs and symptoms of leukemia. So looking at leukemia, here we may have some tissue, and this is extreme case. This is not what is the beginning of it and all, but this is after a diagnosis and some indications we've noticed, and obviously the gingival, you're having overgrowth of it, and so it's quite extensive. Okay, so AIDS and HIV, a lot of times that is first recognized in the mouth also. So we all know that it's an acquired immunodeficiency syndrome. You can have lesions in the mouth because it's a virus. They develop as they break down the T helper cells. So because the patient's immune system is damaged, death is usually caused by an opportunistic infection. Now, an opportunistic infection would be an infection that just being around someone is an opportunity to pick up some type of infection. Just anything minor would attack their immune system. It's normally controlled by the immune system, but in this case, it would not be. Okay, HIV associated gingivitis, usually bright red lines along the border of the gingiva, also known as atypical gingivitis. In some cases, you might see the bright red line from the free gingiva to the attached gingiva. It's also associated with periodontitis. It resembles nectarizing ulcerative gingivitis, which is also called ANUG. So interproximal necrosis, and that means dying of the tissues. Intense erythema on the free and attached gingiva, intense pain, bleeding, and bad breath. So here we have a picture of an atypical periodontal disease in a patient with HIV. And as you can see in this area, we've got a lot of periodontal problems and issues going on. Okay, so with HIV, cervical lymphadenopathy is enlargement of the cervical nodes, and it's frequently seen with AIDS patients. So here's what we have here. This is the lymph node. So lymphadenopathy can be in this area, and this is something that the dentist may pick up when they palpate the neck also during an exam. HIV lymphoma. It's a general term for malignant disorder of the lymph tissue. Again, lumps, swelling, nodules in the area of the oral cavity. That's why the dentist again is going to palpate, feel around the tissues and the neck during an exam. Here we have an intraoral lymphoma in a patient with AIDS. This is the area here, so it's a necrotic area. The tissue's dying. Something called hairy leukoplakia, which is leukoplakia we've already talked about. It can be an important part of the diagnosis. White plaque usually found unilateral or bilateral on the borders of the anterior portion of the tongue. Hairy leukoplakia may spread to cover the entire tongue. It also can appear on the buccal. So we have this hairy leukoplakia here, and as you see, it's a white lesion, and we talked about white lesions being something that catches our eye. So that's hairy leukoplakia. And Kaposi sarcoma is one of the opportunistic infections that occurs in HIV patients. The lesions can appear bluish, blackish, or red. No treatment for Kaposi sarcoma. And here we have a picture of it on the outside of the skin and also in the oral cavity. Okay. All right, we're going to stop here and I'll do another recording and we'll start with herpes simplex.